Our friend Brian Thompson from Peritia Advisors is back with advice as we head into Medicare enrollment season, which you said starts Wednesday,
yes.
So the 15th. So you're busy, my friend.
Yes.
Yes.
We're booked pretty much morning to night,
right,
starting this week.
Okay. So we want to drive home the importance of this Medicare season because you said they're always important, but this is extra important.
This one is going to be extra important this year. There are 35,000 people that lost coverage this year. They have to get something new before the first of the year. They do have some extra time in December that most people don't have, but I've seen more changes and more disruption, more anarchy in the market this year than I've ever seen.
Okay, and you don't want to have any delays because...
No, absolutely not.
If you do, then that's even more disruption for you. Yeah,
exactly.
So, now let's talk about some of the scams, though, that you're seeing. Can we talk about that briefly? Because I know you said those are ramping up this year as well.
The telephone scams, if somebody is calling you and offering you a new Medicare ID card, they're lying to you.
Okay.
If somebody's calling you and needs to check your Medicare ID number over the phone, they're lying to you.
Okay.
It is, none of that is legitimate. Nobody can call you about Medicare.
Okay, so like if people get emails or even text messages, or that's all, that's legit.
Unless it's your agent.
Okay.
No, they cannot reach out to you that way.
Okay.
So.
What I'm talking to about the importance of the drug card, the prescription card, that's different than just the medical, correct? Like
it is.
Yeah.
Well, and the prescription drugs are some of the biggest changes this year. You're seeing a lot of changes from copay, which means you're paying a set amount for that prescription drug every month, to co-insurance, which means you're paying a percentage of whatever the drug costs.
Okay. I think that's confusing to a lot of people.
It makes things a little more scary when you go in because you don't know if it's $3 or $47. It's 13% or 33%.
Yeah.
So.
What's the biggest mistake you have people make with their Medicare? I'm sure there's a lot of them because it's confusing, aside from not using a reputable agent, right?
Not doing things in a timely manner.
Yeah.
Or waiting till the last minute. Hey, my Medicare starts tomorrow, and I need to take care of everything today. I'm sorry, no, it doesn't. It's not. We're working with the federal government. We can't work quite that fast in most cases.
Yes.
So.
Anybody who's worked with the federal government should know that nothing is fast. So
you can start 3 months before the month you turn 65. Start early.
Okay.
Give yourself some options. Don't be the guy that comes in the 2 days before. We managed to shoehorn you in and get everything taken care of, but you didn't have any time to really think about what you were doing.
Right.
Call early. You can have more than one. Excuse me. You can have more than one appointment. You can do.
That's good to know.
You can look at things and take some time rather than at the last second I have to make a decision.
Because that is stressful.
It can have thousands of dollars of impact on the next 12 months for you.
Okay.
So.
Say somebody is 65 and they're still employed full time and their employer offers health insurance. Are they eligible for Medicare A and B? Should they still compare what's the best plan?
As long as they're eligible for A and B, then it becomes a financial question.
Okay.
Which one is more financially beneficial to them? Should they go on Medicare? Should they stay on their employer plan? And there's a lot of moving parts to that. So it's really, is your spouse going to need continuing coverage?
It's true, because they may be too young.
Do we need to put them on an ACA plan, or do they have coverage through their own work? Or there's just a lot of moving parts to it. We're happy to sit down and run through those numbers, and we do that every day.
Okay.
So.
Now, you said that you are pretty much busy day and night right now. So how far in advance are you kind of booking out? So if somebody wants to call and talk to you, like they need to do it now, right?
If you want a business hours appointment, I'm somewhere mid-November right now.
Okay.
But we run anywhere from 7 a.m. to I take appointments as late as 10 or 11 p.m. at night. At p.m. at night, very nice. But we will find a way to fit you in, whether it's a weekend, a Sunday, evening, early morning, whatever. We will get you in.
Yeah.
But call
but
sooner rather than later.
Yep. Absolutely. What else do you want viewers to know who are eligible for Medicare and they're ready to sign up?
You need to talk to somebody that knows the market this year. There are so many things. Whether they're not covering all the doctors, or your drugs may not be covered. Just because you've been comfortable on your plan for 2-3 years, it doesn't mean that your plan is going to be good for you this year.
Right, okay.
Things have changed so much, you really need to do a review with somebody that knows these things.
And that's pretty much every year, right? It changes a little. But you may need change, but this year in particular, because of the coverage,
Right.
you really have to be on it.
You do need to be on
Yeah.
it this year,
Okay.
absolutely.
And where can people call you and get more information and schedule an appointment?
Call me at 319-841-2010. PeritiaAdvisors.com on the internet. You can email info@PeritiaAdvisors.com. We're happy to get you in. There's somebody there answering the phone right now.
Okay, we'll have all this information, of course, on our Facebook page and our website. Brian, always a pleasure.
Thank you.
Thank you much.